Hi, my name is Michael Barnathan, and I am the co-founder and chief technical officer of Living Discoveries Diagnostics. Today, I'm going to be giving you a short demo of Digital Mammographer, our first product which is capable of detecting breast cancer within mammograms. So Digital Mammographer runs on a client-server architecture. I'm going to be starting the server up on my local system. So the server is now running. Then we will head back to the website. You can't access this page currently from the home page, so I'm going to tab over. I've already authenticated such that I can access this page. And I'm just going to upload a normal mammogram in the mediolateral oblique position. This is from the Digital Database for Screening Mammography of the USF. And I'm just going to click Analyze. And that's essentially all that I need to do. It's now being uploaded to the web server. And as soon as that finishes, the scan will start running. It will take about 90 seconds, about 1 minute and a half. And then we'll get back the result and we will see the report. So it just finished uploading, and there we are. We have a connection from the server, and it is going to town. So it loaded the image. These are all transmitted in lossless PNG format that prevents any artifacts from creeping in. We don't digitize to JPEG. And what it's doing now is it's just taking the image, it's performing some pre-processing steps on it, and then it is starting the analysis of the image, isolating the breast from the remainder of the mammogram. This is a film mammogram, so it has some other information. So the breast is now isolated, and what it's doing now is it's taking the regions of the image within that breast, and it is looking for abnormal areas, things that have very high density relative to their surroundings, or have an unusual texture or shape, or have characteristic signs of malignancy, such as what are called spiculations, lines radiating out of the malignancy. Now, in this case, this is a normal image, so we don't expect anything to be shown, and hopefully that is what we will see as soon as this finishes. So this is the longest step. It's actually going through the image. It's breaking it up into regions, and ordinarily it would be sending these off to many servers, but right now it's just using my local system. So these regions are all analyzed in parallel. So as soon as that finishes, that should be the longest step, and then about 10 seconds later we should get the result back. And there it is. So the image has been diagnosed. It has been classified against a database of about 2,000 images. The report has just been saved, so we're going to now send that back to the server, and we will get a result shortly. There we go. We just closed the connection, and boom, there we are. So we have a normal mammogram that was analyzed by Digital Mammographer. No problems were found, which is good. The image was overlaid with some information about the dimensions of the breast, also an estimated area and volume. And then we have some information about the density, masses, calcifications, vasculature, various things that can point to suspicious regions of the image or can otherwise indicate that maybe there's a hidden malignancy present. So this is useful for both doctors and patients. The scan can be saved, it can be printed, you can email it directly to your clinician, you can talk to a radiologist, you can get technical support. So that's basically the normal workflow. This is still somewhat of a prototype, so a lot of these detectors don't yet work or don't yet work correctly. In this case, it's a pretty clear-cut image, so there aren't any problems with distinguishing any of these metrics. But yeah, so that's the normal way that Digital Mammographer works. I will now dive into the prototype a bit and show you more of the internals, show you how some of the abnormal images are diagnosed. So let's head over to MATLAB, which is the language that this is currently written in. So we're in MATLAB now. I've loaded up some data so I can show you how Digital Mammographer works from a lower level standpoint. There are two types of classification that Digital Mammographer performs. There is whole image binary classification. Is this image normal or not? Actually, it's beyond binary. It also has the ability to detect whether an image has benign abnormalities, but that's a complication that we won't get into for this demo. And then there is also the ability to highlight regions of the image which look suspicious. So I'll walk you through both of these first. So what I'm dealing with right now is a data set of about 60 images. 30 of them are normal, 30 of them are cancerous. And I'll just go through a few of them and show you how digital mammographer works and how it classifies them. So we have extracted what are known as features. These are descriptors of the image. This is usually done in batch. We usually do it on the entire data set of over 2,000. That usually runs overnight. So I have those ready. I have trained a statistical model, so it's able to look at these 60 images now and predict whether or not they're more similar to cancer or normal. So I'm just going to walk you through a few of those. So we have actually before I do that, let's add the functions for region of interest discovery and for validation. All right, with that done, so what I'm going to do is take the features that we've extracted from the normal images and the cancerous images. These label from ROIs things, I'll show you what those look like. So for each one of these images, we have some ground truth data that was segmented manually by a radiologist. And we can actually take this and create an overlay the ROI information on the cancer images. So I think I got that right. 1 and 2 are just color channels, so we'll get it on the yellow channel. And there it is. It's somewhat faint. Let's normalize it. There we are. So you can see there's a suspicious region of the image here. We have drawn a circle around it. This image has already been segmented, as we call it. That means that we've taken the image and we've extracted only the most interesting parts according to the algorithm. The lesion falls within the top right corner of that, so it looks like we've taken a successful segmentation. We also have a less aggressive form that only segments out the breast, and that's what we use to report results back to the user. So here, that's clearly the ground truth, so that's present within the image. And now let's see what happens when we attempt to diagnose the image. So I have a few of these, and what I'm going to do is show you the images themselves, and then we will run the region of interest detection algorithm. That will take about 15 to 30 seconds for each image. And what that will do is highlight the regions that we've discovered that look suspicious. Then we'll pause for 5 seconds and do it for the next image. So let's start this. Alright, so here's an image with a focal malignancy here. It's also surrounded by some dense tissue, and it's not immediately clear whether or not this is connected to the tissue or not, but this is clearly the focal malignancy. And as soon as digital mammographer finishes running, let's maximize this so we have a better view. And there it is. So the ground truth is circled in yellow, the diagnosed is circled in red, and we've actually done a better job of identifying the precise borders of the lesion versus the radiologist. So this data set, the one that we're training on, is a little bit imprecise in that the radiologist tends to over-segment. Of course, we don't tend to do that. So here's an image with one focal malignancy here, but there's also something pretty suspicious going on here. And the interesting thing is that the radiologist, as I showed you before, only circled this one, but we really want to identify and call this one out too, because to a radiologist this could be significant. And there we are, and that's exactly what we've done. We've taken this focal density, and we have taken this one, and we've identified both. So this is technically considered a false positive in our study, but actually this is a better result than the radiologist gave. Here's a very dense mammogram where the focal abnormality is here. but it's very difficult to see where it connects, and here's what the radiologist identified, here's what we identified. So again, we've drawn a very precise border around this. So here's a somewhat less subtle lesion, which is nevertheless overshadowed by some very dense tissue here. The abnormality is right over here, and we've identified it, but we also had a false positive over here. That is unfortunately inevitable. You can't get 100% accuracy with any known system. The goal is just to make that rate as small as possible. And we've actually managed to get it around 10%, so we're doing pretty well. There's another example. The radiologist has overdrawn this. We've more precisely segmented it. The pectoral muscle in a craniocaudal mammogram is sometimes a very problematic region. We have some algorithms in place that reduce the likelihood that this will be identified, so it tends not to be much of an issue for digital mammographer. So I think those are all of the images. Yes, this has finished. Now I'll also demonstrate the ability to analyze all of the mammograms and return a binary, is this normal or is this cancer, for the entire data set. So I've basically written some validation functions. And since we've already extracted the features, this is actually very, very fast. We've taken the 30 normal images, 29 malignant, and we've returned both the specificity, that is the portion of, that's 1 minus the false positive rate, and the sensitivity, which is the true positive rate. So sensitivity means that 96% of the time, when there was a cancer in the image, we've detected it, which is superb. That's a lot better than the radiologist, which has 78% sensitivity. And the specificity is essentially related to the false positive rate. So if there isn't a cancer, then this means that 96% of the time we won't identify one. That's one method of evaluating performance. We also use a very quick classifier called k-nearest neighbor to get a basic, what's called a receiver operating characteristic curve. This plots the true and the false positive rates against each other, and the goal is to get the line as close to the top of this graph as we possibly can. So let me explain what's going on here. This dashed line is the performance of a random guess. The vertical axis is the true positive rate. So when this hits 1, that means we're identifying all of the lesions in the 60 image dataset. The x-axis is the false positive rate. So as the false positive rate increases, you can make the classifier more or less sensitive. Of course, if you make it more sensitive, you get more false positives, so you go right on this axis. If you make it less sensitive, you go left. And as you go right, you identify more lesions as well. So what we really care about is the region right over here. So what we're able to do, this essentially means that with about 10% of the, a little more, like 12% of the images identified as false positives, we can actually get 93%, 94% accuracy. And that just rises to 100 when you get to a 25% false positive rate. So this is actually excellent. Radiologists do like maybe that sort of curve. Our performance is very good. We're identifying almost all of the cancers in the data set. We're not identifying very many false positives. The area under this curve, which is commonly used as a measure of performance, is over 91%. So that is excellent. You can't get a classifier that does that well very easily. It took a lot of time, a lot of research to be able to do this. So yeah, those are the internals of Digital Mammographer. We have a lot of other functions that contribute to this. I'm not going to show you how they work. That's proprietary. But this is the summary. This is how the magic happens. So thanks for joining us.